Have you ever wondered how one tiny pill can make such a huge difference for someone's mood and anxiety? Well, today we're going to pull back the curtain on one of the most common antidepressants out there, escitalopram. We're going to get into the nitty-gritty of how it works, but just a quick heads up, this is all for your information. It is absolutely not a substitute for real medical advice from a doctor. You've probably heard of it by its brand name, Lexapro. I mean, this medication is a huge deal. It's prescribed so widely that it's become a real cornerstone in how we treat depression and anxiety today. So let's figure out why. And that's the million-dollar question, right? How on earth does something you swallow make its way up to your brain and actually alter your chemistry? We're going to trace that exact journey from the moment the pill is taken all the way into the microscopic gaps between your brain cells. Okay. So first things first, before we go any deeper, what exactly is this stuff? Let's get a nice, simple definition down. That name, Selective Serotonin Reuptake Inhibitor, it sounds super technical, I know, but it's actually the perfect name because it tells you exactly what it does. Let's break it down. Selective means it targets one thing in particular. That thing is serotonin, which is a key chemical messenger for your mood. And it's a reuptake inhibitor, which means it stops or inhibits your brain cells from reabsorbing that serotonin too quickly. So the bottom line, it leaves more serotonin available in your brain to help regulate your mood. Now, to really understand how this all works, we need to zoom way, way in. We're talking microscopic level. We have to take a quick tour of your brain's incredible communication network. Okay, think of it like this. Your brain cells or neurons are constantly sending little messages to each other. Serotonin is one of those messages. Let's call it the mood message. It gets sent across a tiny little gap called a synapse to the next neuron. Now, after the message is delivered, the sending neuron has a sort of cleanup process called reuptake, where it vacuums up the leftover serotonin. This is all happening billions of times a second in your head. It's amazing. So, this is where escitalopram comes into the picture. It basically shows up and tells that cleanup crew to take a little break. Let's see exactly how that plays out. All right, here's the play-by-play. Step 1, a neuron releases a burst of serotonin. Step 2, normally this little protein, our vacuum cleaner, starts sucking that serotonin back up almost immediately. But step 3, escitalopram steps in and literally blocks the nozzle of that vacuum. And the result? More serotonin hangs around in that gap for longer, which gives it more time to deliver its mood-listing message. The signal gets stronger. And here's a really cool bit of science history for you. Escitalopram is actually an improved version of an older drug called citalopram. See, citalopram was made of two molecules that were mirror images of each other. Think of your left and right hands. But it turned out only one of those molecules was doing all the work. The other was just along for the ride. So scientists figured out how to isolate just the active one, the S molecule, and voila, you get escitalopram, which is more potent and targeted. Pretty clever, right? So we've covered the how it works. Now let's get to the why. What is this powerful little molecule actually used to treat? Officially, the FDA has approved it for major depressive disorder and generalized anxiety disorder. But because it's so good at what it does, balancing serotonin, doctors often find it helpful for other related conditions. They might prescribe it off-label for things like panic disorder, social anxiety, and even OCD. Okay, let's pivot a bit. We've talked a lot of science, but what does all of this actually mean for a person who's prescribed this medication? What's the real-world experience like? This is probably one of the most important things to understand. It doesn't work overnight. It's not like taking an aspirin for a headache. You might start on a 10 milligram dose, but it can take 2, 4, even 6 to 8 weeks to feel the full benefit. Seriously, patience is absolutely essential here. You have to give it time to work. And like pretty much any effective medication, it can have side effects. Some of the most common ones are things like nausea, headaches, maybe feeling a bit tired or having trouble sleeping. Now, the good news is that for many people, these tend to ease up and go away after the first few weeks as their body adjusts. Now, we have to talk about the serious stuff. These are much, much rarer, but they're things you need to be aware of. Something called serotonin syndrome, where you get way too much serotonin, is a medical emergency. It's incredibly rare, but it highlights why you must be under a doctor's supervision when you take this kind of medication. And that brings us to some really crucial safety information. This is the stuff that everyone, whether you take the medication or know someone who does, absolutely has to know. So all SSRI antidepressants have this. It's the FDA's most serious type of warning, and it's called a black box warning. It points out that there can be an increased risk of suicidal thoughts and behaviors, particularly in children, teens, and young adults up to age 25. This risk is highest during the first couple of months of treatment. It means close monitoring by doctors and family during that initial period is non-negotiable. It's that important.
Okay, another really critical safety point. Let's say you've been taking it for a while and you're feeling much better. You might think, great, I'm cured, I can just stop now. Well, why is that such a bad idea?
Because of something called antidepressant discontinuation syndrome, basically your brain gets used to having those higher levels of serotonin. If you suddenly cut off the supply, it's a real shock to the system. People can get dizzy, feel anxious, and experience these really strange sensations people call brain zaps. That is exactly why you have to work with your doctor to slowly, gradually reduce the dose over time. Never, ever stop cold turkey. And finally, let's touch on drug interactions. This is a big one. You can't just mix escitalopram with anything. Combining it with an older class of antidepressants called MAOIs can be fatal. Mixing it with other drugs that also boost serotonin can put you at risk for that serotonin syndrome we mentioned. Even something as common as aspirin or ibuprofen can increase bleeding risk. The takeaway here is simple. Your doctor and pharmacist need to know everything you are taking, no exceptions.
Look, there's no doubt that escitalopram is an incredibly powerful tool. For many people, it's been nothing short of a lifesaver. But it also makes you think. It's just one piece of a much larger puzzle, isn't it?
It leaves us with a bigger question. How do we best use a tool like this as part of a complete approach to mental wellness? One that includes therapy and lifestyle and community. That's a really important conversation for all of us to keep having.